Hello everybody, I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Hospital in Mumbai. I wish to speak to you regarding gender reassignment surgery, a subject very close to my heart. This happens to be a high degree of reconstruction which is taken up in the journey for a patient who is a case of a gender dysphoria, erstwhile known as gender identity disorder. Patients whom you call as transgenders or transsexual patients are those patients who actually have a mismatch between the mind and the body. It so happens that in the journey that they are going through, where they feel that they're entrapped in a body of a different individual, they always want to come out of that entrapment and want to lead a normal, active and a fuller life, for which they always seek the society and the help that they want from the peers, from doctors, from the society and from workplaces around. The whole situation of gender dysphoria, if you ask anybody, would have started maybe years or decades ago in their mind, and they would be looking forward to coming out of the entrapment of this body which they are living with. Gender dysphoria is not a new subject, it's not a new term. In the WPATH, this has been identified now as a non-psychiatric disorder, where somebody who is going through this journey of feeling entrapped and wants to come out of it seeks help from family, from society and from medical fraternity, and looks forward to how to come out of this. I at the Kokilaben Hospital, with a wonderful multidisciplinary team, am able to make a difference to the society of these individuals who actually feel entrapped. What we do here is look forward to their mental understanding of the whole subject. We look forward to how to take them forward to a level where they could be completely out of the situation of worries and anxiety and have reached the final place in the journey. So the journey starts with a wonderful psychiatric workup, which gives us an idea that these are mentally stable patients. These patients seek to change because their mind feels that their body is not what they deserve to be. In such situations, we look forward to two sets of psychiatrists according to the world rules to independently certify a patient, giving them a chance to understand that they are the ones who are logically correct. They are the ones who look forward to getting out of this entrapment by ways of medically helping them out. So the psychiatric workup, the psychosomatic workup helps us to identify these patients that they are stable patients. They are patients who have got a permanent feeling about gender dysphoria. Dysphoria is the opposite of euphoria. Euphoria is where you are exulting, and dysphoria is something where the Greek term talks about it's hard to bear. So it's very hard to bear that they are actually in a different body altogether. The psychiatric workup makes it easy for us to understand that these patients deserve to be given a chance or a status to be brought out of that entrapment and given them the journey that they deserve to. Post-psychiatric workup, they undergo a legal affidavit which pertains to the laws of the land, and they are taken through a hormone replacement therapy. The hormone replacement therapy for a male to female and a female to male obviously are different, and the journey is almost a lifelong journey. The hormones that they have been fighting all through within their body is going to be different right now, the hormones that they seek. The hormone replacement therapy is a monthly, weekly, bi-weekly kind of a situation, and later on can even be prolonged. All patients with hormone replacement therapy for gender dysphoria almost take their hormones lifelong. They are so focused that they would continue to take it lifelong to keep their journey very stable, albeit there should not be any situation of a mental instability or a stress because the hormones are not available. Sadly, because they're not produced in the body, they have to be replaced all the time to keep their journey safe. Many patients who mature themselves after 10, 15, 20 years have actually stopped hormone therapy for a short while. But as I know in this subject for the last decade, most of the patients continue the hormone replacement therapy to the final fulfillment. The gender dysphoria treatment on the surgical aspect begins in a male to female with a single stage surgery. So once a patient is completely clear about what he is seeking, there's a huge discussion between the family, the relatives, the patient as to what we can do. Male to female is a single stage surgery where we create a male to female is a single stage surgery where the male genitalia is removed to bring about in its place a female genitalia, which should be both functional as well as aesthetic. One looks forward to an aesthetic situation where you have a labia majora, labia minora, clitoris, and you have a vagina which is functional and aesthetic, and your male organs which you have seek to remove which include the corpora and the testes, are removed. So this is a single stage surgery which would last n number of hours, which is done with a planning and is called as a vaginoplasty. Out here we are doing a penile skin flap vaginoplasty. I must at this point confess that there are patients who come from different parts of the country and the world who actually are failed vaginoplasty. Failed vaginoplasty, there would be no other tissue left over externally for us to create a new vagina. And we have used sigmoid colon or a sigmoid segment, which is harvested over a flap and brought internally through the abdomen to make a vagina. So sigmoid vagina is not a new discovery, but has been used until now in salvage situations where a previous vagina has failed for some reason. Failed for the reason of depth or dilatation, failed for the reason of shrinkage, failed for the reason of not being functionally or aesthetically active. When we look at a sigmoid vaginoplasty, the sigmoid segment is an intra-abdominal segment, so you have to harvest that and bring it into position where it can subserve as an organ, as a new organ altogether, which was never there. That is in the pelvis, between the rectum in front and the prostate behind, is the area which is created for a new vagina called a sigmoid vagina by a sigmoid vaginoplasty. At this point in time, we at Kokilaben Hospital are able to complete this procedure of sigmoid vaginoplasty by a robotic means. That means by a minimally invasive surgery without opening the abdomen, we have been able to complete sigmoid vaginoplasty robotically. Robotic sigmoid vaginoplasty is a wonderful technique, being minimally invasive, and you've got a segment which helps you to actually be having a vagina in place without any major cuts and problems of recovery.